Thank you very much, and good afternoon. And it is
my honor to be talking to you today from the traditional and unceded territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations, and particularly on this day, the winter solstice, where we have our longest night of the year. It's a time to reflect on what we've been through, and to also think about where we're going, and that is moving towards the light, despite the challenges that we have had over this last few years and that we continue to have. They say that adversity introduces us to ourselves. It's shown that we are strong, resilient, and supportive of each other. But our storm of COVID-19 is not yet over. We are in a different boat, but the consequences of not preparing for what is happening now all around us in our global community is just too great. I know on Friday I had conversations. We spoke about the measures that we thought would be sufficient to get us through this, but I can tell you that over this weekend we have spent a lot of time understanding as much as we could about what is happening with this variant, how it's being transmitted in places around the world, and what is happening here in British Columbia. And today I need to announce additional measures. What we're going to talk about today are new provincial health officer orders that will come into effect on December 22nd and will last until the middle of January. In addition, we'll be talking about how our rapid testing program will supplement what we are doing here in British Columbia now, and we'll talk about our updated measures in our booster program. As you know, we have seen things change in the last few days. There are still many things we do not yet know about Omicron and its impacts on the healthcare system and on people in British Columbia and around the world. I've spent quite a bit of time with colleagues, talking with experts from around the world and watching what is happening globally. As I mentioned last Friday, we were putting together a puzzle, and it still has a lot of spaces and holes, but some things are becoming very clear. One of those is that Omicron is definitely spreading rapidly and is more transmissible than what we have seen with the Delta variants that we've been managing over the last few months. In addition, we're seeing it now rapidly replace Delta as the predominant variant that we are seeing causing illness here in British Columbia, and particularly in the areas that have high populous areas that have had low rates in the past little while in Vancouver Coastal and Fraser Health. There are some things that we don't yet know the details of, and one of those is severity of illness, the potential for significant impacts on our hospital system. And I don't need to say how fragile and how stretched our health care system is, from the community, from long-term care, assisted living, into our acute care facilities at all levels. We know that people have been working very hard. Healthcare workers, whether they're doing case and contact management, testing, tracing, whether we're working in the immunization clinics, in our hospitals, in our long-term care homes. As cases go up, we are stretched more and more. We need to take measures to make sure that we mitigate any impact on our healthcare system. And over this past weekend, it's become clear that our best case scenario about how Omicron might be different in terms of severity are looking less and less likely. We have seen an increase in hospitalization in places like the UK that are ahead of us in terms of transmission of Omicron. And more recently and closer to home, we've seen this as well in Quebec, which is very concerning. We are seeing the replacement, as I mentioned, of Omicron from Delta, and we're also seeing what we call explosive outbreaks, which have to do with larger numbers of people being exposed at the same time, but also a shortening of the incubation period that we're seeing. So the transmission between generations is shorter, and we've seen that around the world as well, in places like Copenhagen, and looking at specific outbreaks in the United States and here in Canada. Those are things that are worrisome to us, because it can signal a dramatic impact in a short period of time on our hospital capacity. As well, we have seen increased evidence of immune escape. Basically, this virus is much more easily able to infect people who have been infected with previous variants of COVID-19, and more easily able to infect people who have been vaccinated, although it's still a magnitude difference from people who don't have the protection that vaccine offers. So some of the information that we have used to make the decisions about the measures that will be in place today are looking at what we're seeing here in British Columbia. And really it is about buying us time to understand and to prepare. The consequences of not slowing things down, of not taking these actions, are just too dire. We need to protect our healthcare system for everybody who needs care. So what we have seen as of today, that we've, even compared to last week, we've seen a rapid takeoff in cases, particularly in Vancouver Coastal, where cases have been low for some time, and also in Fraser Health. We've seen the leveling off in the interior and a rapid increase in Island Health, which has had low cases along the way. We've continued to see decreases in Northern Health, but again, we need to be prepared for this to level off as well. We are at the point where we've seen hospitalizations decrease, and particularly we are still not seeing yet hospitalizations increase dramatically for those people who are unvaccinated or, thankfully, in vaccinated cases. This gives us some suggestion that of the protection that vaccination gives. Having said that, we know this is a lagging indicator, and we've started to see in other jurisdictions that this can also take off quite rapidly. This also reminds us, this slide reminds us that the risk is fundamentally different if you don't have any protection through the immunization that vaccines give us. And we've started to see an increase in both vaccinated and unvaccinated cases. As well, I look at the age groups of where we're seeing transmission, and no surprise, where this transmission is really taking off is in younger people who are more highly connected. They go to work, they have children, there are connections in communities, social connections as well. So 19 to 39 and the 40 to 59 year age group. And of course, as we break that down again between those who have protection from vaccination and those who don't yet, the difference is also very stark. So what does this tell us? This tells us that Omicron is making a difference in our trajectory of our pandemic now in British Columbia, and that we need to take additional actions so that we can manage this and get through yet another wave. So this is the data from our laboratory showing how Omicron is really taking over from Delta and replacing all of the other strains, starting in Vancouver Coastal and not far behind Fraser Health and Island Health as well. And all of this affects our the modeling that is now dramatically changed from even what we showed just last week. Our reproductive number is now above 1 in all regions, although in Northern Health it still is slightly below 1, but trending upwards again. Where we see the most dramatic difference is in Vancouver Coastal Health, where now every case transmits to at least 2 others, and that leads to propagated more rapidly moving outbreaks. This tells us that the exposure, and we are learning about this virus after 2 years, almost 2 years. And we know that it is inevitable now that most of us in the province will be exposed at some point. The way this virus is being transmitted, this strain of the virus is being transmitted in communities across the province, it is over time very likely that all of us will have exposure to it. How it affects us depends on our own actions and what we are doing. And we talked last week about the importance of reducing our social gatherings, and the focus on Friday was how to have safer social gatherings. We are now transitioning to reducing those social gatherings to as low as possible for this period of time to try and reduce that risk of exposure until we can flatten and slow down the curve. The orders that we put in place around personal gatherings will remain, with the really important caveat that the principle needs to be to keep those numbers as small as possible. Minister Farnworth talks about all of the things that we have been through here in BC over the last few months, and I know at this time of the year we need to be with our family. We need to be with our friends, our close friends, to support them, to provide support, to get the support, both emotional and physical support that we need. So we are telling people there are things that you need to do right now. You need to keep your groups as small as possible, and it needs to be the same group of people. So not one family here tonight and another tomorrow and lunch with friends the next day. We need to keep our groups small. We know how to do that. We know how to connect with others in different ways. So pick your group, make it as small as possible, and stick with them this holiday season. Find other ways to safely connect with other people in your life, virtually or outside or at a distance. Second, understand your own risk and the people you live with, people in your family. If somebody has a serious illness that puts them at risk, then cut back on your social activities even more. We have to protect ourselves with these risks. Third, if you are attending the event, know how many people will be there and stick with your own small group. Keep those groups small. Most of these events should not be happening, but if you need to get together, keep it as small as absolutely possible. Understand the setting you're going to. Is it a large venue with lots of space so that you can more safely gather? Is there ventilation? Is there things you can do to improve the ventilation? And can you meet outdoors instead of indoors? Ensure you have all of the layers of protection in place. Given that people the space to stay safe, wearing your masks when you're in indoor settings, especially giving that respectful distance to people. Stay behind barriers, wash your hands, increase ventilation. These are all things that we can do right now. We know that this is a disappointing and discouraging thing to hear at this point in time. People in BC have stepped up. We've done the right thing over and over. We've gotten vaccinated in record numbers. We've supported each other to get booster doses, to have small gatherings, to do the right thing. But the challenge that we have is this virus doesn't recognize that. What it does, it has changed, and so must we. But I know that we can continue to support each other to do this together. So our new public health orders will include a ban on indoor organized gatherings of any size. So that is weddings, wedding receptions, celebratory events, parties, Christmas parties, New Year's parties, whether they're at banquet halls, at event spaces, whether they're an event in a restaurant or in a private setting. We need to stop those for this period of time. We will be closing bars and nightclubs for this short period of time. We know that those are settings where people socialize, where right now those are risky settings, especially for the demographic that we're talking about, where we're seeing widespread transmission. So this does not include pubs and cafes and restaurants. This is the specific liquor licenses, and it'll be detailed in the order, but it is specific to bars and nightclubs. Gyms, fitness centers, and dance studios will also be closed for this period of time. We know as well that these, unfortunately, have been places where transmission events have happened and have spread out to people in the community. So we need to go to the very important remote support for people. And some of these, I know my gym does that, the yoga studios, etc., for this period of time. Restaurants will continue to be able to operate with the meal service that we know is important. We know that these seated events or seated settings are much less risk, but we're going to go back to what worked for us during the last waves of this pandemic, and so that is smaller groups. Maximum of 6 people per table, wearing masks. We already put in last week the importance of not having congregation and people coming together, having additional space or barriers within restaurants, and not moving between tables. And finally, we'll also be adding, we had last week put in capacity limits for the larger venues, of sports events and theaters and concerts. Now seated events will be reduced to 50% capacity regardless of the venue size. So that includes movie theaters, arenas, etc. And again, the really important measures that we know help, which is using the BC vaccine card, checking the QR code, enforcing of mask wearing, and that additional extra space to give room for people and to ensure that there's enough ventilation support around people. So these will come into effect on December 22nd at midnight and will be in effect until January 18th. And that is very specific. There are a number of things that are happening over this period of time, including we need to support the return safe to schools, the K-12 schools, on January 4th, and we're working very closely with our ministry and stakeholder table to support that. And on January 10th is the return to on-campus learning at post-secondary institutions. In addition, this gives us a period of time for us to continue to monitor, to fill in those pieces of the puzzle and to better understand the impact that Omicron is going to have on our context in BC, on our healthcare system, and making sure that those resources are there for all of us. So this is a summary and overview of the public health orders that have been in place and will continue until at least the middle of January. Supplementing part of this is how do we use the rapid antigen tests and the various different forms that we have here in BC to support us getting through this period of time. I want to really emphasize the rapid antigen testing, the point of care testings that we have. These are red lights, not green lights. So having a negative test does not mean that you don't have to pay attention to the gathering limits, to the different measures that we have in place, our layers of protection in the facility, in the places that you are going. So it doesn't mean you can have a larger gathering. It doesn't mean you don't need to wear your mask. The important thing about point of care tests and the PCR testing is that if they're positive, it tells you that you cannot do those things. It is a red light, not a green light. And it is important that these are used for people who have symptoms to help understand what is causing their symptoms, where that will make a difference. And right now we have a lot of people who are lining up for some of our tests that want to just have an understanding of whether they have COVID right now, and that is not where these rapid tests are helpful, and it is leading to long lines in our PCR testing, which we absolutely need to support us being able to understand people who have COVID-19. So to date, we've received a little over 3 million point-of-care tests of a variety of different types of these tests and distributed about 1.26 million across the province in 5 key areas. We are using quite a few in long-term care and acute care to support staff working in those facilities. We have a very successful program that has helped us in provincial corrections from the very beginning, where people are moving in and out of that facility on a rapid basis. We've also been using these really a lot in our remote First Nations communities in particular, to be able to identify if COVID is in a community very quickly, particularly in communities where access to PCR is challenging. We also have been using them for case and contact management, for identifying clusters, for supporting schools where there's been exposure events and outbreaks, supporting post-secondary institutions, supporting workplaces, including we have a lot of testing going on in some of the larger industrial camps where we have group accommodations, where we have accommodations for temporary farm workers, and those business and organizations have been supported in having a variety of testing strategies where we've been involved with them. In the coming weeks and months, we expect to have additional supply of rapid tests. We're expecting a delivery from Canada of 200,000 PanBio rapid tests. These are the ones with a nasal swab that can be broken down and used for individual tests. We've also purchased 500,000 of the BTNX tests that we had not yet received with nasal swabs, and the expected delivery of those is by the end of December. And Canada has told us that we should expect 84 million of 5 different types of rapid tests in the country for all provinces and territories sometime at the end, near the end of January. Of these, about 10 million are expected to be the at-home lateral flow tests, the ones that we have been planning to receive for some time. And we have requested our share, which is about 13.5% of these. So that leaves us about 11 million different types of tests that we expect will arrive sometime in the middle to end of January. Beyond that, it is still unclear what the ongoing supply will be going forward. So our planning right now, between mid-December, between now and between when the ongoing supply comes in, or when the additional supply comes in mid-January, we're currently using about 35,000 tests per week, and we have an inventory of about 2.6 million of different types of tests. We are going to be expanding our use to support the collection or the testing of people at our testing sites, at health sites, people with symptoms. And that's where the majority of these will be going and are going already, to support rapid testing of people with symptoms who are at low risk of having severe illness. And so we can provide advice on how to self-manage their illness. We will be also deploying them over the next few weeks in higher numbers to long-term care, to all long-term care facilities, to assist in use of staff and testing of visitors, along with the ongoing screening that's happening right now. One of the key considerations that I have and we have is to continue to protect the seniors and elders in long-term care. Part of our rationale for the vaccine mandate that we have in place is how important that is to build those walls to make sure that people who are coming in are not infected, and we're going to be adding this additional testing for visitors into long-term care in the coming weeks. We also will continue to use them to support healthcare workers in acute care in facilities around the province. Right now, there's rapid access to PCR tests in many of our acute care facilities, particularly our COVID hospitals. But as this new strain is spreading rapidly in the community, there will be healthcare workers who will be exposed, and we will be supplementing the PCR program with rapid tests to support staying at work, test to stay programs, and investigation of clusters and exposure events. We are also deploying additional 1.2 million of the tests approximately, and this has started already, to remote and rural communities to help detect when Omicron is in, or COVID is in those communities and in First Nations communities, and are looking at how we can deploy them as well to support vulnerable populations. And part of this is about having a strategy in place for rapid testing and access to treatment. If, as we know, that some of the antiviral treatments, Paxlovid in particular, are under review by Health Canada. Canada has purchased millions of doses of these, and we need to have a plan in place to be able to provide rapid access to those who will benefit from antiviral treatment, because it needs to be given within a short period of time. So that's a strategy that we will be making sure we have in place by the time those are approved for use. Currently as well, we have a strategy through our testing centres to make sure we can get rapid access to sotrovimab and some of the other monoclonal antibodies that are still effective against this strain. We'll continue to expand our point-of-care screening program in businesses and organizations, as we know that this can, especially as we mentioned, some of the group accommodations to help manage and prevent outbreaks, and use by regional medical health officers and our health authorities to, again, support and manage outbreaks in communities. Once we receive some of the additional testing that we're expecting in mid-January and beyond, we're going to be expanding access to publicly funded tests at additional locations in the community. This is to help look at how we can manage community spread and protect people who are clinically extremely vulnerable in these communities. A large part of what we're doing in our strategy will be to support K-12 students and staff return to school and continuity of in-person learning. And this is where we can support families to be able to have testing after exposures so that children can remain in school. As well, we'll be using them to support return to campus for post-secondary education for students, faculty, and staff in residences, and expanding the programs that we have had in those areas. And finally, expansion and replenishment for the work that we're doing with rapid tests in long-term care and acute care and in our healthcare facilities across the province. We will, of course, continue to monitor the effectiveness and the utility and how we are using these, and making sure that we can support their effective use for people who have symptoms and need to understand their need to isolate and manage over the coming months. So we are in a very uncertain time. We will be learning more about what Omicron means for us, the context that it's in. We're reserving we're deploying our rapid tests to supplement the testing so that we can understand how it's moving through our communities, and so we can ensure that we have the healthcare resources to keep our healthcare system functioning. And there's much that we will learn in the next few weeks. Part of this as well will be the importance of ramping up our boost program, as we've talked about, and I'll now turn it over to Minister Dix to walk us through that part.
Thank you very much, Dr. Henry, and wanted to speak about our booster campaign across BC, and indeed our vaccination campaign, which has delivered, as you know, one of the highest degrees of vaccination in the world for first and second doses. And our effort for children 5 to 11 has now reached, I think, as of today's numbers are about 107,000 children 5 to 11 have been immunized as well, and focus today on booster doses. And I want to take you through where we are and some of the increases we'll be announcing in the number of booster doses given in BC, administered in BC in the coming days and weeks and months. We announced booster doses for all people in BC 18 and over on October 26th. And sometimes I see comparison between one province and another. We announced that everyone 18 and over at that time on October 26th would receive a booster dose, and that is what's happening. To date, this is as of Sunday night, 727,761 booster or third doses have been administered. We're currently operating at a capacity 35% higher than was previously announced, was announced on October 26th, as we've brought in and are rapidly advancing our pharmacy and health authority clinics. 67% of people aged 70 and above have already received their booster doses, 2 and 3, and that number obviously is growing significantly. And more than half of people over 65 have already received their booster doses, not announced, administered in arms. Approximately 65,000 healthcare workers have received their booster, and 125,000 clinically vulnerable British Columbians have received their third doses, their booster doses as of Sunday, and this is a program which will pay dividends for their health and for the healthcare system in the months to come. It was absolutely right to do, and it's based on our risk-based rollout that has shown its results in the first and second dose immunization. I just want to make this point about it because our immunization rollout continues to be based on risk, with priority given, as we said, to the clinically extremely vulnerable, to long-term care, and we've seen its positive impact there, to seniors, to Indigenous adults, to healthcare workers, and to those who have received 2 doses of AstraZeneca. And this age-based rollout will continue at an accelerated pace with invites sent out when appointments can be guaranteed. What we do in British Columbia is we have a gated system week to week where we send out invitations based on the number of available appointments. And so we go through category by category. So we're not offering appointments to more people in February. We're going week to week to offer appointments based on people's risks. So we're not having people with less risk competing with people with more risk. We're going through age categories systematically, and that's what you're seeing in our rollout, just as you did with first and second doses. So on the left is what's happened up to now, which is that we increased capacity by 35% over the plan we put in place on October 26th. The priority groups are as have been named. The total that was projected for January was 730,000 boosters, and that the booster program would originally, we said end of May, but now with the 35% would be completed by end of April. We are adding to that as of today. And the augmentation, which will start in the coming weeks, and then in January, we'll see an increase in vaccination capacity by 62% overall through health authority clinic expansion. In addition, pharmacy capacity will increase throughout January as the ramp up there continues. The increase in capacity will allow an accelerated booster program and ensure wait times remain reasonable. We won't be offering them to everyone all at once. We're going to go through age category by age category based on risk, based on the medical evidence that supports this program. And you'll see in the next slide the difference in January between what we were planning to do and what we will be doing. A very significant increase week to week in immunizations, capping off at around 320,000, I believe, in the week ending January the 30th. So you see the difference and the significant increase in vaccinations week to week. What have we done to put Scenario 2 in place? Vancouver Coastal Health has secured the Vancouver Convention Centre, and that represents a potential capacity of 130,000 shots in January with a startup of January 5th. And this capacity will serve the entire Metro Vancouver area. Fraser Health has also secured the Guildford site in Surrey, and others will come in Fraser Health. Vancouver Island is securing mass vaccination sites, as is IHA, and Northern Health will be securing partners to deliver a mobile clinic strategy throughout smaller communities in the north. And we're obviously going to be, again, working with many of the community partners that have made our vaccination campaign so successful. Just to put in context what's required to put the Vancouver Convention Centre in place for 6,000 vaccinations a day, it requires 130 immunizers working 12-hour shifts and about 100 non-clinical staff. And that work is happening right now. And so that's the circumstances. You can see a very substantial increase in the number of booster doses for everyone, a continuation of our approach, which is to focus on those who are most at risk first and to move our way down age categories in order to meet that test. I want to bring an update now, which I regularly do, but is a significant update with respect to scheduled surgeries. Scheduled surgeries will be postponed, scheduled non-urgent surgeries, I should say, will be postponed, starting January 4th, 2020, to manage pressures on hospital capacity and also to assist with the redeployment of key staff. Urgent and emergency surgeries will continue. And this is, as we know from our experience in March and April and May of 2020, means that approximately in the range of 3,000 to 3,500 less surgeries a week, allowing our hospital staff to prepare to treat and support and help COVID-19 patients who will be coming to hospital in larger numbers, and as well to support other activities, including immunization. Rescheduling of those appointments will be determined through a monitoring of capacity and the COVID-19 impacts throughout January and on a regional basis. So we'll be looking at all of the regions to do so. And so with that is what's occurring in order to create both the space, the staff space, to support immunization, but also and mainly to support activities in our hospital and what our expectation is about the increased number of COVID-19 cases and other health demands that will be coming to our acute care hospitals. These steps are very difficult, but also necessary. I want to also report out on where we are with respect to the surgical renewal update for the most recent period. In the most recent period, we reported November 21st to November 27th, 6,673 surgeries. And while surgeries continue around the province from December 12th to 18th, health authorities postponed 92 non-urgent scheduled surgeries. That was 1 in Fraser Health, 5 in Vancouver Coastal Health, 3 in Vancouver Island Health, 77 in Interior Health, and 6 in Northern Health. Cumulatively, from September 5th to December 18th, there have been 3,881 surgical postponements. And as has been our commitment all along, each of these patients will get the surgery they need. Clearly, though, the changes we've made in January will challenge us, and we will be required to, again, ramp up surgeries in order to meet that demand and get people the surgeries they need. Our pandemic has challenged us all. Fighting the virus has never been easy. But we all know this. As tired as we are, COVID is not fatigued. It's always seeking new authority in our lives through the opportunities we give it. All of us give it. And the response needs to be energized in order to deal with that. This means for all of us making decisions to reduce our social contacts, and we need to continue to do so. It means the control we get when we get vaccinated and when we get sent an invitation to get our boosters, to get those vaccinations as well. It's the control we exercise when we protect our children, age 5 to 11, with their vaccines. And it's the control we have when we adhere to public health orders, follow public health guidance, and use our COVID sense. As we head into the holidays, no matter how we celebrate this special time of year, we can imbue it with the magic and joy that has always renewed us and those around us. And we can do this without giving COVID new strength and purchase. Every time we use the control we have, every single time, we push back COVID's authority in our lives by slowing its spread, by keeping us safe, and by each of us making the difference for all of us in the moments that matters most. Patients whose surgeries have been postponed these past few weeks, and those impacted right now, and those who will be impacted in January, are dealing with additional anxiety and a challenging time for all of us. We will get you your surgeries. To each of you and your families, you should know this. We've delivered surgeries to 99.6% of the 14,842 patients whose surgeries were postponed from March to May in 2020. We've delivered surgeries to 91.4% of the 3,321 patients whose surgeries were postponed between October 2020 and June 2021. So when we say we will get you your surgeries, when we make that commitment to you, we're giving you our word, and we keep our word. I want to thank everyone in British Columbia for their continuing efforts to support one another during the COVID-19 pandemic, and we're happy to take your questions.